Clinical features of interstitial lung disease. So firstly, looking at the common etiology, that are the causes. It can be due to sarcoidosis, amyloidosis, alveolar proteinosis. Can be due to the vasculitis, example the granulomatosis with polyangiitis. Next, it can also include the infections, example the fungal, the TB, that's tuberculosis, as well as the viral pneumonia. Next, it also includes the occupational and environmental diseases such as the systemic lupus erythematosus and the scleroderma. Next, it also includes the idiopathic pulmonary fibrosis or the interstitial pneumonia. Next, it includes the cryptogenic organizing pneumonia as well. Next, we are going to look at the clinical features or the clinical presentations. It includes the progressive exertional dyspnea or presence of persistent cough, and this is persistent dry cough. Next, also looking at the pulmonary findings, and this is due to the other underlying conditions. What are these conditions? It includes the silicosis and the CTD, that's connective tissue disorders. Next, as well as greater than 50% of the patients, this is with the significant smoking history, as well as in case of the lung examination, there is presence of fine crackles during the mid-late inspiration, as well as it includes the possible digital clubbing. Now, looking at the lab findings of the interstitial lung disease, it includes the chest X-ray. It shows the reticular as well as the nodular opacities. Next, looking at the high resolution chest computed tomography, this shows presence of fibrosis, honeycombing, as well as the traction bronchostasis. Next, looking at the PFT, that's pulmonary function test, they are showing the normal or increased FEV by FVC ratio, as well as the decrease in DLCO and decrease in TLC, as well as decrease in RV. Next, looking at the resting arterial blood gas, it can be normal as well as shows mild hypoxemia. Next, looking at the exertion, usually it causes the significant hypoxemia, and this is due to the V by Q mismatch.